We all know how innocent children are. They are usually busy with their own worlds. They're happy-go-lucky. Not many things affect them adversely, and they like to be in a good mood most often. So when a child is detected to have cancer, how do you deal with the diagnosis, or how do you explain the diagnosis to the child without scaring them? I think the first step is to see how old is the child, what is their mental maturity level, what are they able to grasp, what is the depth up to which they understand their own health. So these are all things that we do in the initial few visits or evaluation visits when children and parents come to us for diagnosis of cancer. If it's a teenager, if it's someone who is beyond the age of 12, 13, and the child has sort of matured enough to understand that about their own health and the diagnosis of cancer, then we usually tend to discuss it with them and tell them that this is what is going on, this is the condition you have, and you will be receiving certain medications, but it is definitely a curable condition. So I think as long as this is explained in a gentle, comprehensive way, but in a positive fashion to the child, a teenager, most often it is faced or it is received quite positively, and we have seen that children actually are not faced too much by it. They do come back to us positively saying, yes doc, I'm going to fight it out and I'm going to come out victorious in the end. When it comes to younger children, they don't really have much understanding about their own health. They're a little helpless because they may not understand all their symptoms. So we have to address it in a different way. We mostly explain the diagnosis to the parents. For the children, we just tell them that, I'll be seeing you often, we'll be giving you medicines, you will have a few needles, but we'll make sure that you are able to get back to running, you'll be able to get back to playing a particular sport, going back to school. So we, phrase it or, project it in such a way that we keep the positivity in focus and ensure that the child looks forward to getting through the treatment so they can get back to doing their activity, their favorite activity, with the usual zeal and energy that they used to have in the past. And this, I think, positively motivates younger and older children to make sure that they are regular for the treatments and they don't miss it, and gives them a positive attitude about the whole diagnosis in general.